Welcome to Healthy Future Vision Channel. Happy to share with you. I often tell my patients, those who've crossed the halfway mark in life, that our bodies have their own voice. We just rarely listen. And one of the clearest ways it speaks is through your urine. It may sound ordinary, but it's the most honest mirror of your kidney health. The quiet organs working day and night to filter everything we put into our bodies. I'm Dr. Michael Grant. I'm 60 years old and I've watched hundreds of people discover kidney failure only when it was already too late. What weighs on me most is this. Many of the signs were there early on, no one noticed. They saw their urine change color, turn foamy, or they woke up to pee several times a night, and they chalked it up to not drinking enough water or just getting older. Then one day they came to see me, tired, pale, with breath that carried a faint ammonia odor. And by then their kidneys were down to 10% capacity. Have you ever wondered why your urine sometimes foams like beer or turns as dark as coffee? I remember a patient named Robert, 58. He came in only because his wife said his urine looked strange. Tests showed protein in the urine, one of the earliest signs of kidney damage. Thankfully, he came early. With diet changes and blood pressure control, his kidney function has stayed stable for 5 years. Had he waited a few more months, he might be on dialysis today. Every morning when you step into the bathroom, treat it like a brief conversation with your own body. If your urine looks brown or red or carries a persistent, unpleasant odor, don't ignore it. That may be your kidneys speaking up, telling you they're in trouble. If you're waking multiple times at night to urinate, it may be more than just age. It can mean your kidneys are losing the ability to conserve water. I know that after 50, we start accepting a lot. Gray hair, lighter sleep, a memory that isn't what it used to be. But you should never accept losing your kidneys as inevitable. Kidneys don't cry out in pain. They send gentle messages through the color, smell, or amount of urine you see each day. If you learn to listen, you can save them. Science shows that people who detect sugar or protein in the urine early are far more likely to preserve kidney function than those who find out late. And it all begins with noticing the smallest things. You don't have to be a doctor. You just have to pay attention. After years in practice, I've learned this. Our bodies try to talk to us in the simplest language possible. A little foam, an unusual night trip to the bathroom, a faint, odd smell, all are ways of saying, I'm tired. So the next time you look into the toilet bowl, don't just flush and move on. Pause for a second, observe, and listen, because sometimes that tiny moment can save the rest of your life. You know, after more than 30 years in medicine, what amazes me most is the kidney's quiet endurance. It doesn't complain, it doesn't ache, it doesn't send you sharp warnings like the heart or the stomach might. It just stays silent. But urine, that's its voice. And if you learn to listen to that voice, you'll know when your body's calling for help. 1. When your urine changes color. It's not a small thing. I once had a patient named Linda, 62 years old, a cheerful woman who loved gardening and started every morning with a cup of coffee. One day she said to me, "Doctor, my urine looked brown yesterday, but it's back to normal today." I'm sure it's nothing, right? She smiled, but I didn't. We ran a test and found red blood cells in her urine, early glomerulonephritis. If she hadn't come in, it could have led to kidney failure within a few years. What I want you to know is this. If your urine looks red, pink, dark brown, or cola-colored, it's not about not drinking enough water. It's your body warning you that tiny vessels in your kidneys may be leaking blood, or that toxins are building up faster than your kidneys can handle. Your body never lies, and the color of your urine is one of its most honest truths. 2. When your urine foams like beer, don't ignore it. Sometimes it's the smallest things that speak the loudest. If your urine looks foamy, thick, and the bubbles linger, it's not just pressure from a strong stream. That foam is often protein, something that belongs in your bloodstream, not your toilet bowl. It leaks out when the kidney's filters are damaged. I remember a patient, James, 59, a former soldier. Tough guy, never complained. He came in only because his wife insisted. She said their toilet looked like dish soap. Tests showed high protein levels in his urine. Had we not caught it then, he could have been on dialysis 3 times a week within a few years. What troubles me is how painless this symptom is. No ache, no swelling, nothing that screams urgent. That's why most people shrug it off. But when protein starts leaking, chronic kidney disease has already begun, and it's hard to reverse. So if you see thick foam that doesn't fade quickly, day after day, don't wait. Let your doctor check. One simple urine test can save your life. 3. When you wake up at night to urinate, it's not just age. Every older adult knows that feeling. You've just drifted into sleep, and suddenly you need to get up and pee. Most people blame it on aging, but often it's nocturia, the kidneys losing their ability to concentrate urine at night. Healthy kidneys know how to hold water while you sleep, so you don't dehydrate. When they weaken, that balance breaks. You start peeing more, sleeping less, and waking up foggy and tired. Many of my patients first came to me complaining about insomnia, only to learn their kidneys were already at stage 2 or 3 failure. I often ask them, do you remember the last time you slept through the night without waking up to pee? And sometimes they just go silent because they've forgotten what that feels like. If you're waking up 2 or 3 times every night, don't dismiss it as just getting older. It might be your kidneys whispering, I'm getting weaker. 4. When your urine looks cloudy or smells foul, I always remind my patients, healthy urine should be clear and have little to no odor. If it becomes cloudy, has a strong ammonia-like smell, turns fishy, or carries an unpleasant odor that lingers for days, it could mean your kidneys or urinary tract are infected. A 55-year-old woman named Maria once came to see me, a bit embarrassed. She said quietly, Doctor, my urine has smelled strange for a few days, but I felt awkward bringing it up. When we ran tests, we found she had a urinary tract infection that had already spread to her kidneys. If she had waited a few more weeks, she might have ended up hospitalized with acute kidney inflammation. Here's what's important. Urinary infections aren't just for young women. Older adults, especially those with diabetes or high blood pressure, are at greater risk because their immune systems aren't as strong. If you notice an unusual smell or experience burning or pain when you urinate, don't hesitate to see your doctor. Your kidneys will thank you for it. 5. When your urine output changes drastically, I once treated a 68-year-old man named Henry. About a month before he was hospitalized, he told me, I've been peeing less, but it's probably just because I don't drink enough water. By the time he came to see me, his blood was full of toxins. His kidneys had stopped filtering properly. He wasn't in pain. He had no fever, no fatigue, until it was far too late. When kidneys weaken, urine volume becomes unpredictable. Some days you may urinate a lot, and other days, almost none. That's not coincidence. It's a warning sign that your kidneys are losing control over fluid balance. If your urine output drops noticeably, especially if you notice swelling in your legs or face, or you feel unusually tired and lose your appetite, go to the hospital. That's your kidneys crying for help. 20 strikes. When sugar shows up in your urine, I've worked with diabetic patients for over 20 years, and one thing never changes. Sugar in the urine is always a warning sign. When your blood sugar climbs above about 180 milligrams per deciliter, the kidneys can no longer reabsorb all the glucose, so it starts leaking into your urine. That's when a routine urinalysis will detect glucose. Many people shrug it off, but by then, tiny blood vessels inside the kidneys are already being damaged. If the condition continues, those delicate filtering tissues gradually scar and stiffen, and by the time symptoms appear, it's often end-stage kidney disease. I remember a patient named Paul, 61, who'd lived with diabetes for nearly a decade. He told me, I thought my blood sugar was under control. I felt fine. But his urine said otherwise. It contained glucose. We adjusted his medication and diet, and thankfully, he avoided kidney complications. I often remind him, sometimes the most dangerous things are the ones you can't feel. 7. When your urine contains sediment, cas, or cells, you can't see it with the naked eye, but under a microscope, doctors can detect tiny tube-shaped structures called casts, almost like the fingerprints of your kidneys. They form when the kidneys are inflamed or the tissue is injured. If we find red blood cell casts or epithelial cell casts, it means your kidneys are dealing with serious inflammation or tubular necrosis, the destruction of kidney tissue. I once told a patient after reviewing his results, "Your body has been sending this signal for months. You just didn't know how to read it." Because all kidney damage starts quietly, long before it becomes critical. A microscopic urinalysis may sound simple, but it's one of the most powerful tools for detecting kidney disease early. And sometimes just a single drop of urine under a microscope tells the truth better than 100 words from a patient. What I've learned after 30 years in medicine. What moves me most after 3 decades in this profession isn't the breakthroughs in medical technology. It's the small changes my patients make in their daily lives. One person finally starts drinking enough water. Another decides to see a doctor early just because their urine looked different. An older patient realizes that sleeping through the night isn't a luxury, it's a sign of healthy kidneys. You see, there's nothing more mysterious in medicine than truly understanding your own body. And there's nothing more heartbreaking than realizing the truth too late. When I was younger, I believed health could be managed with the right pills and the right machines. But as I've grown older, I've learned something much simpler. True health begins with attention. It begins with listening to the smallest changes within yourself. If you remember just one thing from our conversation today, let it be this. Your kidneys can't cry out in pain, but your urine always tells the truth. Pay attention to it, because just 1 minute of observation each morning could protect you for the rest of your life. I know talking about illness is never easy, especially when we've already lived half our lives. But I don't want you to be afraid. I just want you to know. Know that your body is always sending you signals, and that you still have time to make a difference. The kidneys are among the most resilient organs in the human body. They work quietly for years, filtering dozens of gallons of blood every single day, never complaining, never resting. But eventually, if you don't care for them, they grow tired. And when the kidneys grow tired, there is no miracle drug that can bring them fully back. I don't say this to frighten you. I say it with the honesty of someone who's seen too much. Too many patients wishing they had known sooner, paid closer attention, or simply gone for one annual checkup. If you're watching this video, take it as a gentle reminder from a doctor in his 60s, someone who's also learning to slow down, to listen to his own body a little more each day. Tomorrow morning, when you walk into your bathroom, pause for a moment. Look at your urine and ask yourself, what is my body trying to tell me today? And if you notice something unusual, the color, the foam, the smell, the frequency, don't ignore it. Get it checked. A simple urine test could change the rest of your life. If this message resonates with you, share it with someone you care about, a parent, a friend, or anyone entering midlife like you. Because you might be the reason they never have to spend years hooked up to a dialysis machine. I'm Dr. Michael Grant, and I believe this with all my heart. Health isn't something we keep forever. It's something we must nurture every single day. Thank you for listening. And if you'd like to learn more about caring for your kidneys, your heart, and your health after 50, please subscribe. And together, day by day, we'll keep this body strong, peaceful, and grateful for the life we're given.